Are you taking antibiotics? Do you want to know what your cardiovascular disease risk is? This is Diamond Fernandez here with the Heart Fit Clinic, your leaders in heart health. And today I'm going to talk to you about antibiotics and cardiovascular disease risk. There was a study that was done in the European Heart Journal, and it showed a lot of women that were taking antibiotics, and they categorized them into different categories, and those who've never taken antibiotics, those who've taken them for less than 15 consecutive days at a time, those who've been taking it between 15 days and 2 months, and then those who take antibiotics for over 2 months. And so the study showed not so good for antibiotics, and it actually put an increased risk for cardiovascular disease when you are taking antibiotics. And so it's important to make sure that you minimize these antibiotics. And why is the big concern as to what happens to your heart health, and why does it put you at increased risk when you take antibiotics? Now, it's important to take antibiotics to kill a bacteria, but the concern is it also can affect your gut microbiome. And when it affects your gut microbiome, remember, your arteries are a muscle, right? They're not a pipe. And the gut microbiome, the pathophysiology of the gut is very similar to the pathophysiology of the artery. Remember, the arteries are a muscle, right? Not a pipe. And it's just like skin inside an arterial wall. What can affect that? The gut can get affected with that as well. And so what happens is when we're on prolonged use of antibiotics, we can affect the gut microbiome. When we affect the gut microbiome, we end up with cardiovascular disease. And so 90% of all diseases, they actually start in our digestive system. So it's very important to understand that cardiovascular disease risk. And so make sure you understand that taking antibiotics can put you at increased risk of cardiovascular disease, and make sure that you understand, of course, your risk factors so that you can prevent that heart attack or stroke. Could talk lots more about this, but for any questions, comments, or observations, I definitely welcome them below. Look forward to helping you live happier, healthier.